chatting with Helene Campbell at the break, and she was reflecting about how lucky we are as Canadians to have a universal healthcare system and how important it is to us as Canadians. And so I want to talk to you about what I think it'll take to make sure that that system endures and is there to serve us as we move forward. But before we go to the future, I want to go to the past. This picture is about 100 years old. It's from First World War. It's British soldiers in the trenches in the First World War. And I'd actually even go 100 years before that, to the early part of the 19th century, when the Industrial Revolution was well underway in Britain, as Britain moved from being an agricultural society to an industrial society, and in so doing really became the dominant world superpower. And it became the dominant world superpower at a considerable human cost. And so by the end of the 19th century, by the end of the 1800s in Britain, if, for example, you were born to a coal miner or to a factory worker in Manchester, odds were you wouldn't live to be 6 years old. Most kids died by the age of 6, working class kids in Manchester. In London, laborers would start being laborers as children, and life expectancy was 22. So the people who noticed this, though, the people who noticed this were military recruiters, because Britain got into something called the Boer War, it's turning into a history lesson, into the Boer War in the late 19th century, war with South Africa. And military recruiters going to try to find soldiers realized they couldn't because the health of young men was so poor. And that actually led to one of the very first universal screening programs in the world. As the United Kingdom, getting ready for the next war, realized that it needed to improve the health of young people, and so began a medical and dental screening program, followed by medical and dental care. Really the first time we saw, in a widespread way, an investment in child health. So this is our army, our baby army, here in Canada. And what do we need our army for? It's hopefully not to go and fight a war in foreign lands. I think we need a baby army to deal with this problem, which is the aging of our population. And you hear a lot about this. I actually kind of object to the term silver tsunami. I think it's quite rude to talk about our parents and our grandparents as some kind of natural disaster that's befalling us. But you know, the headline writers like it. And really it's a reference to the fact that the population is aging. And this is an inevitable fact. We will all be a year older in 2016 than we are today. And so most recently, you might have seen some of the data reported by Statistics Canada in September. It led all the newscasts. I'm sure Mark had experts talking about it on his program. For the first time in Canada's history, there are more seniors than kids. And so this was a great tragedy. It's going to kill the healthcare system. We heard a lot about it. What we did not hear a word about was another stat that was also released by Statistics Canada at the same time, which is that the child and youth population in Canada is actually growing. So in this city, 20 years from now, there will be 70,000 more kids than there are today. So there'll be as many kids as there are today, plus 70,000. In Canada, if you think of it across the country, 20 years from now, there'll be 1.2 million more kids than there are presently. So basically the equivalent of an entire province of Manitoba worth of additional kids in 20 years. So the child and youth population is growing. And in that is the solution to this problem. Now, every analysis that's been done of healthcare spending tells us that the aging population adds somewhere between 0.8 to 1% per year of additional cost to our healthcare system. So that's $1.5 billion. That's, I still live in a world where $1.5 billion is a lot of money, but 1% is a manageable cost pressure in our system. But one of the areas where Canada is actually doing quite poorly when it compares to other Western countries is in chronic disease, in heart disease, in diabetes, in mental illness, where our rates of illness are higher than in most other Western countries. And so in all of that is really the central message that I want to leave you with today, which is that if we take care of the health of our baby army, if we make sure that these 1.2 million extra kids that are on the way grow up to be healthy and successful, then we can deal with this so-called silver tsunami. Now, this is not some kind of Whitney Houston, children are our future kind of sentimental thing. This is hard-headed economics, and it works in two ways. The first is that if kids are healthy, if we put kids on a path to lifelong health, they will become taxpayers, workers, innovators, parents, caregivers. If we don't, not only are they not contributing but as much, but there's a double whammy because then they start to compete with the seniors who need increasing levels of care. Nothing we can do about aging, lots we can do about chronic disease. Now, some of the signs around chronic disease are a bit worrisome. And the two big burdens of illness for young people are, in fact, obesity and mental illness. CHEO opened in 1974, and I had the opportunity last year to go to a retirement party for a nurse in the diabetes clinic. She spent not all but most of those 40 years in the diabetes clinic, was there on day one when the hospital opened and retired 40 years later in 2014. Nikki Dolan is her name, and her observation was that when she started at CHEO, the only kids they saw in the diabetes clinic were kids with type 1 congenital inborn diabetes. And as she left 40 years later, they were now seeing kids that had type 2 diabetes that's been acquired typically because of weight gain and lack of balanced diet. And in that 40 years that she worked at CHEO, we in fact saw a tripling of the childhood obesity rate. And childhood obesity is a driver of heart disease, of diabetes, and of a significant utilization of our healthcare system. In the last 5 years at CHEO, we've seen a 75% increase in the number of people coming to the hospital because of mental illness. And I know you heard from Jack Kitts earlier today. At the Ottawa hospital, at what we would call an adult hospital, the two biggest group of patients in terms of how much they use the system are frail elderly and are adults with mental health and addictions challenges. And we know that 70% of those adults first encountered their challenges with mental illness when they were adolescents. So we can do something to put teenagers on the path to health. We will not only change their future, we will change the future of our healthcare system. So we call this at CHEO Pedianomics. Don't bother going and looking this up in the Oxford English Dictionary. It's not yet there. It's a made-up word. And I'm going to give you, and I know this is exactly what you want on a Saturday night after 4 sugar donuts, I'm going to give you a little math lesson in Pedianomics. I'll make it quick, but to illustrate the point. Over the next 10 years, it's estimated in Canada we will spend $500 billion in the healthcare system, so not economic costs or social costs, but just treatment costs to treat people who are suffering from mental illness, obesity-related illness, or consequences of premature birth. $500 billion. If we were able to reduce that cost, that treatment expense, by just 3%, we'd shake loose $15 billion, and that $15 billion would be enough to deal with the aging of the population and the extra demands that are put on our system by that aging population. So that's the takeaway message. If we, even by a relatively modest amount, do better when it comes to chronic disease, we can shake loose more than enough money to make sure that our parents and grandparents have the health care that they need and that they deserve. And so that's not what we're doing, though, at the moment. In Ontario, for example, we are reducing funding to children's hospitals and moving it to hospitals that serve adults because the pressure and the demand is there. And when it comes to looking at the future, we need to think about care, policy, and research as ways that we can make this math, our Pedianomics math, work. So what do I mean by that? You know, there's a difference between me having to wait a year for a hip replacement, which I don't need yet, but I will, and a child having to wait 12 or 18 months for eye surgery or a tonsillectomy, which is what happens in our community right now. Too many kids waiting too long for the care they need, and has a big impact on their development, on their growth, and on their success in school. It's a problem if a young person has to wait 12 or 18 months to see a psychiatrist, a psychologist, or a social worker for support with their mental health issues. We can put these kids on the path to lifelong health so that they are able to contribute and that they are not a burden for the healthcare system 20 or 30 years from now. But that means we need to invest today. So we need to think about making sure that access to care is there for kids. We need to think about some of our policy responses to issues like obesity. And I think very soon we will get into debates in our country, in our society, about whether or not we should tax sugar-sweetened beverages in the kinds of way that we tax cigarettes, and whether we should ban the marketing of junk food at children, which has been shown to be a driver when it comes to childhood obesity. We also need to invest in child research, child health research. You know, I'll give you one example. Ontario has the highest rates of inflammatory bowel disease, so that's colitis, Crohn's colitis, ileitis, in the world. So why is that? We don't know why that is. But that is a chronic illness. It can be fatal. Not typically, it can be though, and certainly it is a tremendous healthcare burden if somebody is struggling with inflammatory bowel disease for their whole life. So we need to research the causes of poor health in children, again, so that we can put them on the path to lifelong health. Otherwise, this cute little guy, 12 years from now, is going to be lining up for bariatric surgery. This baby will be getting dialysis in 20 years, and she will, in 25 years, be lining up for triple bypass surgery. And if you think this is an exaggeration, we just had a report out of the United States last week where an 8-year-old child has developed heart disease as a complication arising from obesity. So, do we want these kids lining up for these procedures, which means they're not out there paying taxes, they're not out there innovating, creating, being able to be a caregiver. They're competing with some of us and with our parents for access to health care? Or do we want to invest in their well-being, put them on the road to lifelong health, and thus ensure the future viability and sustainability of our healthcare system? That's Pedianomics, and that's what you should care about when you think about the future of our healthcare system. Thank you very much.